Good morning, and today's discussion on Ranjit Anesthesia Academy online would be about shoulder dystocia. And I'm sure shoulder dystocia is a topic which has been close to everybody's heart, not because the heart is closer to the shoulder, but then it's something which is extremely difficult to manage because it's going to be an emergency. Dystocia on the Oxford English Dictionary means difficult birth, typically caused by a large or awkwardly positioned fetus by smallness of the maternal pelvis. And that is the definition in the Oxford textbook of dictionary, which is particular to that of English and not obstetrics, but that is what is the meaning of the word dystocia. This was a statement by J. Morris in the year 1955, which said the delivery of the head with or without forceps may have been quite easy. Time passes. The child's face becomes suffused. It endeavors unsuccessfully to breathe. Abdominal efforts by the mother or by her attendants produce no advance. Gentle head traction is equally unavailing. Usually, equanimity forsakes the attendants. They push, then pull. Alarm increases. Eventually, by greater strength of muscles or by some infernal juggle, the difficulty appears to be overcome and the shoulders and trunk of a goodly child are delivered. The pallor of its body contrasts with the plum-colored cyanosis of the face and the small quantity of freshly expelled meconium about the buttocks. It dawns upon the attendants that their anxiety was not ill-founded. The baby lies limp and voiceless, and only too often remains so despite all efforts at resuscitation. And so that's a very sad scenario, but not something which is uncommon we see in everyday's practice. So, diagnosis of shoulder dystocia is usually ill done. And how can we do it? We can see the turtle sign, but when we see the turtle sign, in the sense the head has come out and shoulders have not descended down, and so the look of the turtle may be there for the baby's head. But then when we see turtle sign, we diagnose shoulder dystocia, but we are too late, and that's something which we have to act immediately, or something which you have to tell it as imminent. And so diagnosing a turtle sign is actually too late. Head to completion of delivery interval of more than 60 seconds is something which we keep. So if the head delivers and the shoulder doesn't deliver within 60 seconds, then we can call that as shoulder dystocia. And if we use additional maneuvers to deliver the shoulders, then you could call that as shoulder dystocia. So the attempt of shoulder dystocia drills or diagnosing shoulder dystocia and managing it is usually ill recorded, or the incidence is not proper reported or under reported. But anyway, the diagnosis could be done with this variety of signs on the list. Coming to feto-pelvic relationships, before we go on into the entire matter of shoulder dystocia, 3 diameters of the pelvic brim. The anteroposterior is the narrowest in the brim. Bis acromial diameter is more than the biparietal diameter.